Hi, this is Lieutenant Governor Tim Griffin. We're here in my office getting ready for the live Facebook town hall. And I've got Dr. Jennifer Delahaye from the Department of Health. She is an infectious disease specialist, and we're going to get underway in about 10 minutes. But I just wanted to come on for a second and ask you if you could share the link with your friends, get some more people, and we'll be ramping up in about just a little under 10 minutes. And as we go, I've got staff who are going to be keeping an eye on the comments and looking for any questions you might have that might be relevant to this conversation. So we'll be kicking off shortly. If you've already joined us, we appreciate it. And please share it with some friends. And let's see how many people we can get on the watching tonight. Does that mean stop? Yeah. Okay, good. That's a Hi, this is Lieutenant Governor Tim Griffin. I want to thank y'all for joining me and Dr. Jennifer Delahaye here tonight. We thought we'd take a little time to discuss the coronavirus and how we can best protect ourselves and protect our loved ones, protect everybody here in Arkansas. And I want to welcome Dr. Jennifer Delahaye. She is one of the key players in leading this effort to combat coronavirus in Arkansas. And I guess your official role when you're not doing this is just an infectious disease specialist generally, right?
Well, I serve as the state epidemiologist now at the health department, so I would continue in that role if we weren't doing that.
Sure. So and you're the chief epidemiologist for the state.
Yeah, and I'm the medical director for immunizations and outbreak response, and I've been doing that for some time now at the health department.
Great. And so you are well versed in the response to the coronavirus. Yes. I really appreciate you coming tonight. One of the things that has struck me, Doctor, as I go about my life, and certainly all of our routines have changed, and even here we have to sit further apart. As you probably know, we met in the legislature today, and I preside over the Senate. We had to put some senators up in the balcony and practice social distancing. So everything has really changed for us, but there are a lot of people I talk with who are still a little uncertain about some of the guidance that's been given to them, and maybe they've heard the guidance, but they don't quite know why we do certain things. And also, there are some questions that I think others have that are sort of common sense questions that come up when you're trying to apply some of this guidance in your daily life and protect your family. And so I thought this would be a good opportunity for us to discuss some of that. Before I get into some of the maybe more novel questions, I thought I would go over some basics with you. And there's a lot of allergies this time of year.
Sure.
And every day when I get up, I have 3 young children and my wife, and we're trying to. I have to get out for certain reasons, but we're generally staying at home to the extent possible, and I have to leave to work. But every morning I sort of get up and assess whether I'm feeling sick, because I want to be ahead of it if I'm starting to feel that way. And with all of the pollen and all of spring and the allergies sort of this type of year is known for, sometimes I do cough a little bit, and I have to figure out, hey, is that attributable to COVID-19 or is that something else? So if you could go over some of the basic symptoms when we get up every morning or as we go about our day. The fever's a pretty easy one to know. I know that when I came in the Capitol today, they took my temperature to make sure I didn't have a fever. Okay, I get that. But other than that, what should people be looking for? Is it aches like a flu? Those aches that we feel when we have the flu? Is it sneezing and watery eyes like a cold? What is it really that people are describing?
Well, it can be a range of symptoms. Some people will develop a fever, and they don't recognize it at first sometimes because they don't feel so terribly bad. But if a person knows that they may have been exposed, it's no harm in checking your fever a couple of times a day and tracking that. And if you spike a fever, it goes up past 100.4, then just stay home and see how you do. And then other people will have symptoms. Now, most people who have allergies know they have allergies, and they've had them before, and it's this time of year perhaps, and it's the same time every year, and they're familiar with those. So if it's the same thing you've always had this time of year for allergies, then it's probably allergies. But some people do experience cough, sore throat, symptoms of flu-like symptoms. People that progress and get sicker may have fatigue, body aches, and so forth. And it is hard to tell whether this is COVID-19 or is this the flu or some other respiratory virus?
So do we, at this time of year, are we still seeing a lot of the flu that we experience every year? Is there still a lot of that going on? I mean, we're almost at the end of March. I normally don't think of that as flu season.
Well, we are still seeing flu all around the state, so it's widespread, but the percentage of cases seen in doctor's office or the emergency room is down. And I think just a couple of weeks ago it was a pretty high intensity, and now it's low, minimal intensity. And part of that, I think, is the fact that people are doing social distancing, and it's had an impact on how much flu we're seeing around the state.
So some of the things that we've adopted to help address the COVID-19 threat are helping in other areas, such as the traditional flu that we have every season, and maybe even colds. We're washing our hands more, right?
Yes, right.
We're not shaking hands. We're 6 feet away from each other. So let me ask you, just as a practical matter, and there's been a lot in the press about several of these things, but I wanted to make sure we covered them here. If people think they may have COVID-19, they're experiencing some of the symptoms that you just described, what should they do? I know the initial guidance was don't go to a doctor immediately, don't go to the emergency room, don't clog up the hospital, call a healthcare provider. Is that still the best advice?
Yes. If people are feeling ill, they should stay home and they should self-isolate. So if you're in a household like yourself with other family members, stay in a separate room. If you need to enter a room with someone else, get a mask, surgical mask, and put it on. Or if you don't have a mask, just put a bandana on so that you can prevent yourself from spreading it to people in your household. And then you should take care to wipe down the commonly used surfaces, doorknobs, tables, and so forth, so that it's not transmitted that way. We know that the main way that this virus is spread is through respiratory droplets. So that's when people cough or sneeze. Those droplets are
little bits of moisture.
Yes,
okay.
And they've got virus in it. And they fall out within a few feet. So if someone's 6 feet away, they're not likely to get those droplets on them. But surfaces such as tabletops and can get those droplets, and then the virus is there. It can stay viable on plastic or stainless steel for 3 days.
Okay.
So people
That's
need
really
to,
helpful
yes. So people need to get in the habit of wiping the surfaces in their homes on a regular basis. Good household cleaning products will do the job. People should read the directions on the bottle and follow them in order to make sure that the product they're using is as effective as it should be.
And so, correct me if I'm wrong, but the principle behind a bandana is not that it's some kind of high-tech filter, but it's simply stopping the droplets from being spread around the room.
Right.
Pretty basic concept, right?
Yes, and you can wash it and reuse it.
Right.
And we've had a lot of discussion in the state about healthcare providers not having enough of the masks that they would like to have. So if the people at home are not using those masks, healthcare providers can use them, and they can use a bandana or some other form of cloth that would block the spread of those droplets.
Gotcha. I just want to encourage our viewers to ask questions right there on Facebook. And we've got Michael here and David here who are looking those over, and will share some of those questions with me. And maybe we'll be able to get to your question before we finish this evening. I wanted to go back to something you said about if you're in the home with a lot of other people, you need to separate. If you feel sick, you separate from them. Mm-hmm. It may just be in my home, but I get the sense that a lot of people are social distancing outside the door of their home. Mm-hmm. but within the four walls of their home, it's sort of like, this is family, not so much social distancing. And for example, in my home, no one's sick right now, thank the Lord. But we practice social distancing, 6 feet, sort of staying away from others outside our door. But within our home, with 3 young kids, there's not always a lot of social distancing. But you're saying if someone does feel ill within the home, you need to separate yourself, if possible, within that home.
Yes, that is important if it's possible. It's not always possible. And sometimes if someone has a known exposure, they know they have been exposed to someone with COVID-19, and
but they're not feeling sick necessarily.
Right.
Okay. What should those people
Well, they
do?
should also quarantine themselves. And so people get mixed up with what isolation and quarantine is. So quarantine is someone who's been exposed, and it takes up to 14 days for someone to become ill. So people stay away from other people for 14 days in case they develop illness during that incubation period. And if they don't, then they're free to go about their business at the end after those 14 days have passed. Isolation is when a person is ill. And you take some of the same steps, but we isolate in our homes when we're ill, or we isolate a patient in the hospital when they're ill or may have this disease or are known to have that disease. So that's the difference in the meaning of those 2 words.
But as a general matter, both would be setting yourself apart.
Yes.
From the rest
Right.
of your household. I mean, look, we try to do that in my household. If I get a bad cold or the flu, and we've got a lot going on with 3 kids, and so I'll sleep in a room, in a guest room, or in another room until I feel better.
Yes.
That concept.
Yes, it's the same idea, but I think in this situation, people should be more strict about it. That person shouldn't go out of that room during the day if they're sick. They should stay there, and hopefully someone in the family can bring them food to that room and leave it even at the door if they're sick, so that person can pick it up.
Gotcha.
And then the dishes should be washed in a way that it's not transmitting the virus to other people in the household.
I want to talk now, you just mentioned taking food to a room for someone, sort of helping someone out so that that person can stay either isolated or quarantined. That reminds me of the most vulnerable among us, seniors and individuals with compromised immune systems or compromised respiratory systems. These are individuals that I think collectively we have said should try to stay home if at all possible.
Yes.
And should rely on someone, another Arkansan, a friend, someone helping them get food. Can you talk a little bit about that population, in terms of the senior population and those that may have an underlying health condition, and what different they need to do, and what that profile looks like? I think it's pretty self-explanatory. The more senior members of our society, people in their 80s and 90s, for example, some of that's fairly obvious. But is there anything you want to tell us to help us better understand what to do to protect the elderly and people with other underlying conditions?
Sure. So, people can take steps to prevent themselves from being infected. But when you're working with that population, the older adults or people who have some kind of chronic health problem, no matter what their age, and they need to stay home, then you have to think about how do you keep yourself, you think of yourself as potentially infecting them.
Right.
So you want to take steps to prevent from introducing the virus to their home if you're going to take something to them. So an important thing would be to clean your hands before you go there. Hand sanitizer, perhaps, if you have that. And then provide them with what they need. You may wish to leave it at the door and let them pick it up.
Leave it on the porch, leave it in a screen porch, leave it at the doorstep.
Right. And you would not want to go there if you yourself had fever or symptoms.
Yeah.
So those are important. But even more so, what many people need, older adults and other people who are social distancing by staying at home, that can be a very lonely time for people.
Yeah. And they're not having social interaction. They're not having visitors.
Yes.
Yeah.
And
they feel alone.
It's a mental health
in many ways
component to it. So staying connected, a good old fashioned telephone call would be wonderful, or FaceTiming or other ways of staying connected. Writing a letter, old-fashioned letter can mean a lot to people. And sharing, you can even watch movies together. They watch a movie at their location, you watch the same movie at your location, and then you talk about it. Or you read the same book and talk about it. There's lots of things that people can do to engage and interact. And these are things that we've not been in the habit of doing.
Well, and it brings up a good point, and David was just telling me we had someone from Saline County. David, what's the name of the individual from Saline County? So we have I think a gentleman in Saline County who raises the issues. What do you say to people who think, well, I'm young and I'm healthy and I'm not worried about this virus, and I don't want to follow this guidance. I think that relates to what you were talking about there. It ultimately may not be about me. It's not about me. It's not about some 20-year-old necessarily. Although anyone at any age can fall ill as a result of this virus, but it's a statistical matter. If you're 20, you may think, well, chances of me getting really sick are slim compared to others. But I think the point you've just made is that it's not about any one individual person. It's about the person that you might infect. And I tell you, my mother is 79, and she's very energetic. She loves to get around in her car. Anybody that knows my mother, a lot of people know her because she loves to walk up to folks and just start chatting, particularly at the Kroger near where I live. And she loves to get out. She's very social. And so I've had to say, and Ben over here is smiling because he knows how wonderful and funny and engaging my mother is, but she does not do well with staying in the house. And what I have told her is there's a lot of people out there who may be carrying this virus. They may or may not know it.
Yes.
And one interaction could spread it to her, and she does not have any serious underlying health condition, but she's 79. And so I worry about that. So I have told her, please, let's sort of stay in place. If you need anything, I'll bring it to you. And so I guess all of this relates to what you just discussed, but also relates to the issue raised by, I believe it's the gentleman in Saline County who's asking, what do we say to those people who don't want to follow that guidance? What I say is, it's not about you and your health. It's about your grandmother's health, your neighbor's health, the person you don't know who may have a compromised immune system's health.
Well, I think one of the important things to remember is that people can get this disease, this illness, at any age. They may not be severely affected by it, but they can spread it really well. And young people are really excellent spreaders of respiratory viruses. And that's important for people to remember.
So are they an excellent spreader because of some physiological trait, or is it because they just move around all the time?
Well, of course, children are just excellent spreaders. They don't get necessarily very ill with this. So then there's a gradual increase in age, and so those people that don't get really ill may have prolonged shedding of the virus. It's the virus replicates in the respiratory systems, the nose in the beginning up here, and then down into the lungs. And so
it starts in the nasal passages and in the head and moves down. Okay.
Before a person has symptoms, they may have a lot of viral particles there, a heavy load of it. And then as the immune system kicks in and starts to fight those viral particles, that's when people start feeling ill. So they can be spreading it before they feel particularly ill. And young people are the ones that are most likely not to feel that ill compared to older adults.
Their immune systems are so robust. They may never feel it ultimately, right?
Yeah.
I mean, there would be.
So, yes, but they can still spread it.
Sure.
And I think that's a really important point.
Well, we have another good question here, and I apologize, I'm not hearing some of the names. But we have a question that someone was wanting to know, what would be the difference between the symptoms of bronchitis and COVID-19? What are some distinguishing characteristics of the symptoms?
Well, I'm afraid that it wouldn't be very easy to tell them apart.
Okay.
So this COVID-19 does cause lower respiratory illness, like pneumonias in lungs. So it would produce a lot of coughing as a result, and someone may not be able to tell the difference between coughing as the result of bronchitis.
That's part of the danger, right?
Right.
People don't know they have it. They think they've got something else.
Yes. So then the question is, well, when should they go to the doctor to be evaluated? And it's helpful to call doctor's office in advance and discuss it with them, and they can give them guidance. Exactly.
Wait there for hours and potentially spread it around the emergency room, right? Or whatever.
Right. So and so many doctor's offices are now doing telemedicine type things, so they could potentially do that with their doctor and discuss it to see if they need to be evaluated in person.
And you mentioned telemedicine. I'm a big advocate for telemedicine, and I think it's really important, particularly at a time like this. I need to. I think I'd be remiss if I didn't recognize that both President Trump and the governor, Governor Hutchinson, have both been very forward-leaning on telemedicine and promoting telemedicine in the context of this current fight. Can you comment on that and the benefits of that?
Sure. So a lot of times people, they don't really know, should I be evaluated or should I not? And this is an easy way to answer that question without leaving your own home. And then if there's enough information in the interchange between the patient and the provider, then a decision could be made. Yes, this person may need to be tested for coronavirus, and then they could tell them where to go. And many places have kind of a setup where people can drive through and get tested. And if that's available, then that's a really good way of avoiding exposing people in the health system.
Right, and you may increase the number of people that you can see.
Yes.
If you're sort of using telehealth, telemedicine as a way to filter out people that think they might have it, but after consulting with them through telemedicine, you decide maybe they don't have it. And we need obviously to keep to save our capacity for the more serious patients. I think we have a really good question from Shane, who is a middle-aged man who lives with his elderly mother. And it sounds like he's been hearing what you've been talking about in terms of the potential threat of exposure to the elderly. And his question is, should he take certain steps to isolate or quarantine himself to make sure they're living in the same home, under the same roof? And if his elderly mother is there all day long, she's doing the right thing. And Shane may have to go out for this or that. Other than just following the basic guidelines of washing the hands, keeping the distance, not gathering in large groups, etc., what should he do to get a comfort level that he's not putting his elderly mother at risk?
Right. So the fear would be that he would bring the virus home to her. And so there are things he can do, and hand hygiene is really important. So one thing he could do is what I have done in my home. I have hand sanitizer in the entryway. So as soon as I come in the house, before I touch a whole lot of things, I clean my hands. But you can
Not
also...
just before a meal,
Right.
but routinely.
So that I'm not touching things in the house after I come in and bringing it. He can also have hand sanitizer in his car. So before say he goes to the grocery store, and he may have picked up the virus in the grocery store. So if he has hand sanitizer either with him in his pocket or right when he gets in the car, he can use it so he's not contaminating his car. He can use it when he exits the car so he's not bringing it home. So people need to think about these kinds of transitions and what they can do to prevent from tracking that virus with them wherever they go. That's
Gotcha.
one thing that people can do.
Really good advice. Thank you for that, Shane. And I want to just mention Bobby from Magnolia. I probably know Bobby. I'm from Magnolia. I don't know if I know this Bobby, but I know some Bobbies from Magnolia. But hello to Magnolia. Bobby raised the issue of, I believe his general point is using online grocery pickup services
Yes.
or delivery services, which also applies to takeout food and using other means of getting the toiletries and the necessities, the food that you or maybe your family, your elderly mother, for example, need without spending a lot of time hanging out in a grocery store the way a lot of us do.
Yes.
I'll go to the grocery store for one thing. I'll come home with 100 things, and I will have seen 20 people there that I know, including my mother. So those days, at least for now, are over.
Right.
And so utilizing these resources that we have online are a really good idea. One of the things that we're sort of running out of time here, but I wanted to cover a couple things. First of all, I want to mention some critical websites. And the governor, you're a big part of the governor's effort. Governor Hutchinson's doing a great job. One of the things that you can really do to stay up on this is watch the governor's press conferences. They are often at the Department of Health. They routinely include Nate Smith, sometimes you, Doctor, and others from the Department of Health. And they're very informative, and there's a lot of great guidance. Some of it is some suggestions and some requirements that come out of these press conferences, but they're really good. They're usually held at 1:30 in the afternoon. I think today's was 2:30 in the afternoon, but you can find that out on the governor's website. But I wanted to give some of these resources real quickly. My website, and we have sort of a summary of links and materials on our website. My website is ltgovernor, one word, .arkansas.gov, and I think it's showing up there, ltgovernor.arkansas.gov, and there's a big link there, big graphic, what you need to know, coronavirus, COVID-19. You can click on that, and lots of different resources. Not only resources that relate to your health, but resources that relate to the economic suffering that a lot of families and businesses are having to go through right now. And there are state and federal resources that can help you in that regard. And of course, you can always call my office, 501-682-2144. I want to mention some other websites. The website of the health department, we're blessed to have an outstanding health department here in Arkansas. www.healthy.arkansas.gov. healthy.arkansas.gov. AEDC, for those of you looking for advice on economic, financial, business-related matters, maybe some resources that can help you make it through these challenging times. ArkansasEDC.com. For the military out there, that's Arkansas Echo Delta Charlie.com. The CDC has a website, coronavirus.gov. Coronavirus.gov. And then Department of Workforce Services for information on unemployment and what have you, dws.arkansas.gov. So glad I could get those to you. One thing I wanted to cover before we wrap up is I've tried to cover some practical things because we're all in this together. You've heard that said a lot, but it's true. The individual actions of me and you can determine the severity and length of this for all of us. And, you know, there are a lot of practical things that we just don't know the answer, a lot of practical questions we don't know the answers to. And a few of them that have just come up in my mind as I've tried to navigate this and keep my family safe, and I believe a lot of other people have maybe thought of this, are questions about takeout food and shopping. I just wanted to ask you these. So we've talked a lot about takeout food and we promote it. You can't go in and sit down at a restaurant, but we've been promoting driving through and picking up and what have you. And I've done that several times, did it today for my family. What is the risk? You talked about the coronavirus surviving, living on a surface for up to 3 days. So when I pull up to a restaurant and they hand me my bag of food or box of food or whatever, what if any precautions should I take? I mean, you can wash your hands when you get home, but ultimately you've got to unpack that stuff and hand the plates to your kids, and they're going to wash their hands. But is that just such a low threat we're willing to take that chance so that people can get food? Or can you talk a little bit about that?
Sure. So restaurants have processes that they must go through in preparing food, like wearing gloves and washing their hands and so forth. So it's very unlikely that a worker would contaminate the packaging.
Right.
Of course, a lot of the packages are taken out, they're stacks, you have stacks of cups and stuff, so the individual things that the food comes in would unlikely have the virus on it. That the worker who's packing that box of food would have to be an active case of coronavirus. And it's unlikely that they would be, and then even if they were, that it would be their hands, and they wear those plastic gloves and they change them. So if they're following routine standard procedures and how to prepare food in restaurants, it would not highly unlikely.
Yeah, and I would say this, and I've seen some emails from different companies about what they're doing to increase the health measures, sanitation measures during this time. And so I think a lot of the restaurants are going out of their way with taking additional steps they wouldn't normally take.
Yes.
And so that's encouraging. And one more thing, and I've seen this discussed on some television, some news programs, but groceries. I've had a lot of people ask me, what about the groceries? I go in, I pack all this stuff in, I'm scanning it, I'm touching the screen at the checkout or whatever, I box all this in. I assume that it's a chance, but also extremely low chance. I mean, you're going to take the food out of these boxes ultimately in some form or fashion, and you're going to wash your hands before you eat. So while it could be on a box, maybe you put a box up 3 days later, it's no longer a threat. I mean, again, highly unlikely. Is that fair?
Yeah, I think that's fair. I think a person in the grocery store would be more likely to pick up the virus from the checkout counters and the things that are often touched. So I encourage
Self-checkout.
Yes.
Yeah.
Or the cart handles,
Right.
or,
And there are a lot of hand sanitizer.
Yes. So it doesn't hurt to take something with you to wipe things down, or as soon as you leave, before you enter your car, clean your hands.
Gotcha. Well, I just want to say thank you for being here. You know, this is the advice you're giving is so practical for so many people who are having to live a different sort of life. We all are. Mm-hmm. And we all want to stay healthy. We all want our family to stay healthy. And the advice that you've given us tonight is usable, practical, applicable, really helpful advice, and I appreciate it. I just want to say to the folks that joined us and the folks that asked questions, thank you so much for joining us. Our plans are to have this sort of town hall, Facebook Live town hall, every Thursday at this same time at 6 o'clock until we get through this. And we'll have different guests. You know, there's a lot of great things that Arkansans are doing for other Arkansans. I call that Arkansas grit. And we might even have a show that just emphasizes a lot of the positive things that Arkansans are doing for each other, and how we're really coming together like one big family, which we are here in the state. So thank you for joining us, Dr. Delahaye. Thank you to you and all the healthcare professionals, Nate Smith, Matt Gilmore, who's running around here, around my office somewhere, who works with you, all the folks over there who are working with the governor and doing such an outstanding job. Thank you. Thank you for joining us. We appreciate it, and keep an eye out for the next one. Thanks so much.
Thank you.